Welcome to Friday Value Video. This week, we're going to talk about psychosomatic. Are there some issues that you're dealing with that may be psychosomatic, physical, medical? Now, before you get defensive about this topic, I want you to hear me out. Your brain is the most fascinating part of you, or I should say your mind. It's still a mystery. I believe we can study the brain until the end of time and still not have a full understanding of its complexities. So when I say psychosomatic, I don't mean that it's all in your head. I mean that your brain may be causing things to happen without your awareness. Now, yes, we're going to be studying the brain to the end of time, but there are many brilliant people who have observed some very interesting things about how your brain responds to stress, to strong emotions, and to life circumstances. Now, there's a book titled The Mindbody Prescription, which was written by John Sarno, MD, and you may find it's helpful if you're battling a chronic condition or chronic pain of some kind. And as I said, it's not that your issues are in your head, but it could be how your brain is possibly literally creating a medical or physical issue in order to distract away from a serious emotional issue. Again, not that it's all in your head. The pain is real. The issue is real. The disease is real. The blood work shows it. But what's the cause? Why is it there? We're always looking for why. We're always looking for a diagnosis, but a diagnosis is just labeling symptoms. Why are the symptoms there? Dr. Sarno coined this term, Tension Myositis Syndrome, TMS, and he believed that this was a causative factor in many people's issues, and he's pretty successful at helping a lot of people. Now, here's someone else that you may have never heard of, Dr. Bates. I read his book, The Bates Method for Better Eyesight Without Glasses, decades ago. This is a very old book. This has been around a long time. Now, he was a vision expert, and he observed that every young child who came in with vision issues had an emotional answer to the question, when did you first notice your sight was impaired? The answer was always about an emotional event, like their family moved or they lost a loved one, maybe a grandparent. They never gave a time frame, like 3 months ago or a year ago. They always tied it to an emotional event. Interesting, don't you think? Now, if you happen to be interested in learning more about natural eyesight improvement or natural vision improvement, shoot me an email because I know some people who are experts in teaching this that you might really want to check out. Back to the topic, though. The reason I'm sharing this information with you is so you can explore the possibility that you may be experiencing pain or disease as a way to distract from a serious issue that occurred in your life. I was discussing this with somebody who's been battling an autoimmune disorder for a few years now, and she stated her issues began shortly after a traumatic event with her husband. So, could it be emotions that are not pleasant to deal with, like rage or fear, are deliberately hidden by your brain by creating an issue that's considered acceptable in polite society? If you happen to be filled with rage because a loved one died, you can't tell people that you're angry that your loved one left you, especially if it was something horrible like an accident. But it's acceptable to have a medical issue or a chronic pain issue. This way, you don't have to deal with the real issue that may not be considered acceptable. So, is it a response to some kind of traumatic event? Distraction from fear, anger, rage. Now, I don't agree with every single page written in Dr. Sarno's book. Most of us won't agree with every page we read, but I do agree there are many basic issues in our lives, even something simple like overwhelming responsibilities that cause us to not get enough sleep or never have any time to relax or always on the go. Or what if we live completely alone? There's no support in our lives, nobody to talk to. We feel alone when we're in a crowded room. Those are things that could end up wreaking havoc. So there are many possible reasons to have hidden rage or fear. The interesting thing is Dr. Sarno reports a very high success rate with his patients when they learn that their brain may be the problem, not their body. So search your emotions to have lifelong well-being. Thank you for joining me, and I'll see you next week.